The field of brain-computer interfaces is advancing rapidly, but one of the biggest challenges has always been ensuring the long-term reliability of implanted devices. That's why the early results from Neuralink are so remarkable. 3 patients who received brain implants have exceeded expectations, achieving breakthrough capabilities without any reported risks. This success has only strengthened Elon Musk's confidence, pushing him to develop an even more advanced version of the implant. His latest plan aims to expand the technology's reach to help more individuals with disabilities regain lost functions. This year, the number of implant recipients is expected to increase significantly, raising the question of whether this marks a major turning point in public trust toward Neuralink. Despite the groundbreaking progress, Neuralink remains one of the most debated companies under Musk's leadership. Many argue that he should focus more on his electric vehicles and space ventures rather than a field that is still not widely accepted. The risks of implanting technology in the brain, potential security threats, and ethical concerns about brain data being compromised continue to fuel skepticism. However, for those who have received the implant, Neuralink represents something far greater. It has given them a second chance at life. Imagine losing the ability to move, speak, or interact with the world, only to regain control through thought alone. For these 3 individuals, the implant is not just a piece of technology. It's hope, freedom, and a new beginning. Among those benefiting from this technology is Nolan, who became the first person to receive a Neuralink implant last year. He suffered a spinal cord injury that left him paralyzed from shoulders down, making him reliant on caregivers. Before the implant, he used a mouth stick to control his tablet, a method that was both exhausting and limiting. After joining Neuralink's study, his life changed dramatically. With the implant, he can now control a cursor with his thoughts, navigate the internet, play games, and study independently. His ability to engage with the world has expanded significantly, allowing him to learn subjects like mathematics, philosophy, and programming. Though there was an initial issue where some electrode threads retracted, the problem was quickly resolved and no further complications have occurred. Recently, Nolan even challenged himself to use telepathic control continuously for a 72-hour live stream, showcasing the technology's potential. Another key participant is Alex, a former automotive designer who became paralyzed after a car accident. Before the injury, he had a passion for creating custom car parts, but his condition made it impossible to continue his craft. Neuralink changed that. With the implant, Alex can now fully design 3D objects and create digital artwork using specialized software. He has also learned to program Arduino projects, something that would have been unthinkable before. Beyond regaining his ability to work, the implant has given him greater independence in everyday life. He can now control his smartphone using only his thoughts, helping him navigate while traveling, search for parts online, and even choose music while on the go. Recently, he became the first person to participate in a study that explores controlling robotic limbs through Neuralink's technology. In a major breakthrough, Alex successfully used a robotic arm to play the guitar for the first time since his accident. Musk has even suggested that robotic limbs controlled by Neuralink could one day surpass biological ones in precision and speed. The third patient, Brad, faces a different challenge. Diagnosed with advanced ALS, he has lost nearly all ability to move or speak, relying on an eye-tracking device to communicate. However, these devices have limitations, struggling to function in bright environments. Before receiving the implant, Brad had to stay in dimly lit spaces, severely restricting his interactions. Now, with Neuralink, he can type messages using his thoughts, allowing him to communicate freely in any setting. This advancement has restored his ability to engage with his family and community. He has attended his son's robotics competition, interacted with neighbors, and even participated in a live Q&A at his local church. Neuralink is now working on a more advanced communication system for Brad, integrating AI to enable near-natural speech. This could allow individuals like him to have conversations at a normal pace and potentially communicate through humanoid robots in the future. With these promising results, Neuralink is preparing to expand its trials significantly. The company aims to increase the number of implant procedures this year, with studies focused on helping paralyzed individuals regain control over computers, smartphones, and even robotic limbs. The potential applications are vast. Musk has long envisioned a future where those who have lost limbs can seamlessly integrate with robotic replacements, effectively blurring the line between human and machine. This could mark a turning point in assistive technology, enabling people with severe disabilities to regain independence and re-enter the workforce. Currently, Neuralink is recruiting more participants for its trials in the United States, with operations expanding to Canada and the United Kingdom. It is estimated that around 180,000 Americans live with quadriplegia, with thousands of new cases emerging each year. For these individuals, traditional assistive technology often falls short, leaving them isolated and dependent on caregivers. Neuralink's brain interface offers a path toward greater autonomy, allowing users to interact with technology as seamlessly as able-bodied individuals. Beyond its impact on individuals, this technology could transform society as a whole. It opens up new career opportunities for those with mobility impairments, enabling them to work in fields such as software development, graphic design, and research. By eliminating barriers to employment, Neuralink could shift the perception of disability from a limitation to a challenge that technology can overcome. As advancements continue, the possibilities extend far beyond paralysis treatment. In the future, Neuralink's technology could be used to combat neurological disorders like Alzheimer's and Parkinson's, or even enhance cognitive abilities. While ethical and safety concerns remain, the company's progress so far suggests that brain-computer interfaces could revolutionize how humans interact with technology. If developed responsibly, this technology could reshape lives, opening new frontiers in human potential. What do you think about Neuralink's future? Could this technology redefine what's possible in the coming decades?